Is to prevent getting the disease in the first thing. And we really need to just keep pushing through this social distancing.
Okay, the Prime Minister is up, but let me tell you, it's not just the people watching TV that are brave, it's also you. Thank you very much, Doctor. Take good care. And here is the Prime Minister of Canada.
New crisis. Families and loved ones continue to grieve and seek answers. I want to ensure them and all Canadians that we have been working hard to get accountability and justice, even as we fight this pandemic. At the same time, we've also been developing a strategy with our other international partners to make sure that such a tragedy never happens again. Today, I'm appointing the Honourable Ralph Goodale as my special advisor for Canada's ongoing response to the downing of Flight 752. With his decades of extraordinary service to Canada, including as Minister of Public Safety, Ralph has the right expertise to guide our response to this air disaster and provide recommendations for best practices going forward. He will also continue to push to see families properly compensated. The second thing I want to do is share a story with you. A few weeks ago, Dave Caputo, the owner of a startup in Trustcore in the Waterloo region, called a meeting with his employees. With mounting concerns around COVID-19, Dave asked his team how they could repurpose their building materials factory to make products hospitals needed. A few days later, they had 4 prototypes drawn up. They decided to make large panels, which hospitals could use to subdivide rooms and isolate people with COVID-19 from other patients. Well, on Monday, panels made of fully recycled materials were delivered at no cost to several hospitals in the region, including Grand River, St. Mary's, and Guelph General Hospital. Dave and his team showed what Canadians do in difficult times. We don't back down from a challenge. We roll up our sleeves and we get to work. I know that this pandemic has been incredibly challenging for people right across the country, but we're also seeing the best of what it means to be Canadian. From coast to coast to coast, businesses are retooling to produce face shields, ventilators, hand sanitizers, and other supplies our healthcare professionals need. To make it easier for companies to help out during this critical time, we launched Canada's plan to mobilize industry to fight COVID-19 a little over a week ago. In the time since, we've spoken directly to almost 3,000 companies who've reached out to offer their help. Before we go any further, I want to thank all the owners and entrepreneurs and managers who've answered our call to action. This vital support comes at a critical time. And the way you looked around and said, not how can I keep myself safe, but how can I keep myself and my employees safe and help out in this critical time, is a real sign of leadership and a sign of what Canadians do best. In tough times, we pull together, we're there for each other, we put up our hands and we ask, how can we help? I also want, in the same vein, to thank everyone who's making, shipping, and delivering these products. People who work on the manufacturing sector and in terms of getting people the items they need are on the front lines of this fight. Our country needs you through these tough times, and we thank you deeply for everything you do.
When we announced the Canadian plan to mobilize industries to fight COVID-19, we said that we were reaching agreements with Thornhill Medical, Medicom, and Spartans Bioscience. Today, we are announcing the signature of supply contracts with those 3 Canadian companies to manufacture medical equipment such as respirators, surgical masks, and other diagnostic materials. Minister Baines played one of the foremost roles in making this happen. We have also signed letters of intent with 5 other companies: Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. By mobilizing industry, we can produce the goods that are needed by our healthcare professionals right here in Canada in order to protect their health, to protect other patients, and to stop the spread of the virus.
Mobilize industry. We said that we were close to reaching agreements with Thornhill Medical, Medicom, and Spartan Bioscience. Today, we're announcing that we have moved forward with contracts with these 3 Canadian companies to make medical supplies such as ventilators, surgical masks, and test kits. I want to recognize the great work Minister Baines has done to make this happen. We've also signed letters of intent with 5 other companies: Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. We know that the demand for critical equipment and supplies will grow in the coming weeks, so we need a sustainable, stable supply of these products. And that means making them at home, and we're optimistic that they will be available in the coming weeks. So today, I'm also announcing that our existing next-generation manufacturing supercluster will be leading companies in developing and scaling up new technologies to test and treat Canadians. Demand for these goods is going up, so we're making sure Canada is ready to keep up. That's why our government is also allocating $2 billion to purchase protective personal equipment, including for bulk purchases with provinces and territories. This includes things like more masks and face shields, gowns, ventilators, test kits and swabs, and hand sanitizer. Protective personal equipment is essential to protect our healthcare workers who are on the front lines of this fight. We recognize that more is needed, and everyone is working day and night to receive essential supplies. We're coordinating with the provinces and territories, the Public Health Agency, and the experts to make sure our healthcare workers get everything they need. This is a priority for our government, and we will continue to source new solutions every day. We're expecting shipments to come in the coming days, and we will continue to work tirelessly to get these supplies to where they're needed.
A number of companies have also donated equipment and medical equipment to fight COVID-19. Alibaba sent us 500,000 surgical masks and 10,000 testing kits to help us. The group, the COVID-19 medical group that brings together engineers, entrepreneurs, and other health care professionals, is working with a number of companies to provide medical equipment. Up until now, they have been able to get a commitment from Bombardier, 3M, and Medtronic to produce personal protective equipment. And Toys R Us has pledged to provide monitors for babies so that there can be better communication between patients and healthcare professionals. Those monitors will also help to reduce unnecessary travel within the facilities. I want to thank the many companies who have made a donation for their leadership and generosity. You are doing your share, and all Canadians will have to follow your lead.
That we will need more masks, ventilators, and testing kits. But how many more we need depends entirely on you. If you stay home and follow public health recommendations, you can slow the spread. And that means fewer patients in our hospitals, fewer people to test, fewer ventilators to use on critical patients. So keep doing your part and help us keep Canada safe. Merci beaucoup.
Merci beaucoup, Monsieur le Premier ministre. Nous allons commencer avec la période de questions par téléphone aujourd'hui. Modérateur, c'est à vous.
Thank you. Merci. The first question, Maura Forrest, Politico. Your line is open.
Thank you, Prime Minister. Yesterday, you were asked about pipeline construction continuing on the Trans Mountain expansion, and you said you'd have a better answer today. Now, Jason Kenney is saying construction will start on the Keystone XL pipeline as early as April 1st. Do you have concerns about construction continuing on these projects? Do you think it should stop?
I can assure you that Crown corporations, all Crown corporations, are following all the best medical advice. Je peux vous assurer que toutes les compagnies du gouvernement sont en train de suivre
Crown corporations are following all the advice provided by our medical experts.
Politico?
Yes, I mean, that didn't really answer my question. I guess that means you're comfortable with construction continuing. But my follow-up question is about the wage subsidy. You initially promised it at 10%, then last week it was hiked to 75%, but still seemed to be targeted towards small and medium-sized businesses. Now it's available to all businesses. I'm wondering why you've taken such an incremental approach to this measure, given that you're now asking employers to hire back people that they've already laid off.
This situation has been evolving rapidly, as we all know. We're putting in place unprecedented measures to respond to the needs that people are expressing on how we're going to be able to get through this together, how we're going to be able to stay home, self-isolate, not go into work, and yet still be able to pick up our economy when we're through this particular crisis. That is the focus that we've had, and that's why what we're offering is a 75% wage subsidy to companies large and small, nonprofit sector and charitable sector included, so that people can stay on the payroll while they stay home and stay isolated, so that we can ensure that we do bounce back strongly from this once we're through this period.
Merci. Prochaine question.
Thank you. Merci. Next question, Mike Blanchfield, the Canadian Press. Your line is open.
Good morning, Prime Minister. You talked about shipments coming in the coming days and the fact that more will be needed, obviously. So I think what I'd like you to do is, can you walk us through your decision-making process around the cabinet table, how you decide how these scarce medical resources will be allocated in the near future? How precisely in detail do you decide what goes where?
Thank you, Mike, for your question. It's a very good one, and I can tell you that we don't decide around the cabinet table. It is not politicians who decide how resources are allocated. We rely on experts, on medical officials, on coordination between medical officials in all different provinces to make the determination on where things are most needed, and we follow the direct advice of medical experts in terms of how to ensure that everyone, everywhere, has the equipment they need.
Follow-up question?
So what input? Yes. So what input then are you looking for from provinces and municipalities as they struggle with this? And does this ramp up of Canadian production, is this a reflection that this has to be a made in Canada solution? We can't rely on exports or imports from the United States, let's say?
We continue to work very, very closely with the provinces to know exactly what the needs are, what the supplies are, where potential gaps might be appearing, depending on trend lines and different modeling. We are in constant communication to ensure that the resources needed in different parts of the country will get there exactly when they're needed. And on the second question, yes, on procurement, the entire world is trying to get its hands on the various equipment needed to fight this virus. That is why we know that it'll be important to be able to have made in Canada solutions. And I am incredibly, incredibly proud of Canadian companies, Canadian suppliers and manufacturers who are stepping up and saying, we want to help, we will help make ventilators, we will help make masks and gowns and all the things that we are going to need in the coming weeks. It has been a truly amazing and inspiring story to see how many factories and manufacturers are stepping up. In the meantime, we're continuing to work very hard on procurement solutions to get the items that we need for the coming weeks. Okay. Je suis d'abord extrêmement inspiré par ce que les manufacturiers et les compagnies canadiennes
what Canadian companies and manufacturers are doing. We recognize that there is a huge demand right around the world for this equipment, and it's important to have made in Canada solutions so that we can meet our own needs in the weeks and months to come. In the meantime, we are working with all the provinces to look at their needs and coordinate all of that work so that they get the necessary equipment when and where they need it. And at the same time, we are working on delivering that equipment in the coming days.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI, à vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to know what kind of assurances have you been given from companies, the 5 new companies you just announced, that this material will be available in time in order to meet needs. We are trying to expedite all those processes, but we also recognize that it will take a little bit of time, probably a few weeks, before that equipment arrives from our Canadian manufacturers. And that's why we are continuing to receive shipments of material from around the world. And yes, and with respect to Agicrom that will be producing N95 masks, how many masks are ready now or will be ready very soon? I don't have that information, but I know that there will be a press conference following this one where more information will be available about procurement.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir, à vous.
Good morning, Mr. Trudeau. I'd like to come back to construction work that is proceeding on TMX. You say that they are following medical advice, but there are some workers who are very worried about these people coming back into the region. Why not suspend that work to protect the residents? Well, we know that Indigenous communities in Canada are very vulnerable, and that's why special measures are being taken right across the country to ensure that COVID-19 does not spread to those communities, which are already quite stressed in terms of their own medical system and the number of people who live in housing units. So we know there's more that needs to be done. Now, with respect to construction work, I am confident that the company is taking all the necessary steps to keep people safe. My follow-up is on another topic. Now, with respect to the emergency benefit, now you're saying the CERB will amount to $2,000 per month, but what about someone who's on minimum wage? Are you not concerned that somebody or some people will want to get that benefit rather than continuing to work? Well, this is a very difficult situation, and what's important is to ensure that people can self-isolate and take whatever steps are needed to stay safe and keep their families safe. At the same time, we know that there are some jobs that are more essential than others, and I'm quite confident that by working with the provinces, that we will be able to ensure that what needs to be done continues to be done, and that Canadians have the money they need to continue to pay their rent and do their groceries. This is something we will continue to work on together.
We recognize that people need money to be able to stay home and pay their rents and be able to buy groceries. This is a situation that is unprecedented, and it was really important for us to get money into people's pockets quickly. We recognize that there are going to be challenges around certain essential services, and we're going to work with provinces, and we're going to encourage people to find solutions that will allow people to stay safe while they continue to do the job they need to do.
Prime Minister, I'm wondering, you've talked a lot, and your cabinet ministers have talked a lot about there being enough protective gear for healthcare workers, but we're hearing from healthcare workers that they're being rationed and that they're concerned, that they're afraid to go into work. How do you explain that difference, I guess, between their perspective and the government's?
I think one of the issues that we're facing with is we're looking at a number of different models where worst case scenarios are fairly dire, but the expected track is reasonable and something we think we're going to be able to manage. I think healthcare workers and everyone needs to keep in mind what the potential worst case scenarios are, and that's why it continues to be so important, not just for us to prepare for every eventuality and be very careful and responsible about how we use the equipment we have, but also impress upon Canadians how important it is that the decisions you make today, whether you go out and how you go out, if you do go out, will have a direct impact on the need that healthcare professionals will be facing a week from now, 10 days from now. That's why it is so important for everyone to keep pressure off our healthcare system by staying home, by making sure that you're making smart choices to keep us all safe.
Pour faire un peu un suivi, M. Trudeau, bonjour, Christian Noël de Radio-Canada.
We have nurses who are saying that the hospitals are telling them to take those masks, to take them home and wash them and bring them back the next day. Is there such a serious shortage that healthcare workers should be endangering their own health? Well, I think we have to be prepared for any eventuality. I think that's the responsible thing to do. And we are looking at ways of ensuring that we have a proper supply of all equipment based on potential scenarios in the coming days. But I can assure you that we are working together to provide shipments of other equipment, and we are working with Canadian companies to produce more equipment. And once again, we are reminding Canadians that the choices that we make today, if we stay at home, or if we do go out, will have a direct impact on the demands placed on our health care system in the coming week. And that's why everyone has to do his or her part.
It's extremely important for everyone to do their part in staying home, in making sure that a week from now, 10 days from now, we aren't overwhelmed in our healthcare system. We are looking at a range of models that could lead to different outcomes. We're, of course, preparing for the worst case scenarios, but working towards and certainly hoping for a best case scenario. But that entirely depends on citizens being responsible in their choices. As for decisions made by medical professionals on managing the supplies that they have, I can only salute them for the work that they're working so hard and the decisions they're making to keep us all safe as a country and to keep themselves safe so they can keep keeping us safe.
Now, at the
international level, there's kind of a mini war right now where people are trying to get equipment. Does that concern you? Do you think that Canada could end up with a shortage? Are you concerned about that? Well, I think there are a lot of things of concern to us in this situation. The health of all Canadians, that's my primary concern. And of course, the health of our healthcare workers, who are trying to keep us safe. We are working with our embassies internationally to ensure a proper supply of other equipment, and we expect to receive more equipment in the coming days. We will continue to be there to accept those deliveries, but at the same time, it's very important to mobilize industry so that we can get that equipment produced here in Canada and have our own supply chain mobilized here in Canada. And that's exactly what we're doing now. And again, I want to thank Canadian manufacturers and businesses who have stepped up to adjust their production and provide that equipment if it's needed for Canada and around the world.
We are, of course, working hard to make sure that we receive shipments of needed supplies in the coming days. And I can assure you that our embassy staff around the world is strongly engaged in exactly that. But that's also why it is so important that we have made in Canada supply chains to provide us with this essential equipment for the coming weeks, for the coming months. And that's why I am so pleased to be able to thank the manufacturers and producers across this country who've switched their production over to making this necessary medical equipment because it will ensure that we have solutions in Canada that will cover our needs.
Good morning, Prime Minister. Olivia Stepanovich, CBC News. The Americans are said to be most aggressively scooping up personal protective equipment on the international market. I'm wondering if you found that to be the case, and if so, if you have prevailed upon President Trump to work together to come up with a common North American strategy so you can quickly ship ventilators and other personal protective equipment across the continent to priority areas.
We are working very hard to ensure that Canada receives the equipment that we need, both in the short term and in the medium term, creates production facilities to ensure that we can cover our needs. We understand that countries around the world are taking their own approaches. We will continue to coordinate as much as possible, but every step of the way, our priority will be ensuring that Canada is able to take care of its own.
But are you working with President Trump on a North American strategy? And also, can you tell us exactly how much medical gear has been deployed and delivered so far?
We have been able to cover all our needs up until this point, and expect to be able to cover our needs for medical equipment in the foreseeable future. But that is why it is so important for us to ramp up domestic production as well. And with the United States, we continue to coordinate on a broad range of issues.
We will continue to coordinate our efforts with the United States on many different issues, but our priority will always be to ensure that Canadians have the equipment they need to stay safe and healthy.
Has been deployed and delivered so far?
That's a question for the ministers who will be addressing this a little later today.
Brian Mullen, Global News. Prime Minister, with rent due tomorrow, many small and medium-sized Canadian businesses are worried about paying their landlords. What can the federal government do? Is rent forgiveness in some shape or form on the table?
We've already worked with CMHC to ensure that many mortgages are able to be deferred. We've put more money in the pockets of businesses, or putting more money in the pockets of businesses through this wage subsidy, the 75%, that will take off a significant amount of pressure. We've also made available a $40,000 loan for small businesses through the banks that'll be interest-free for the first year, and as they go through it, $10,000 of it, under certain conditions, will be non-repayable at the end. So there are direct measures for companies to be able to get the liquidity necessary to get through the coming months, so that we can be strong once we get through this crisis at the end of it.
Two First Nations communities in Manitoba and other communities are requesting military hospitals be set up. Is this something that the government is contemplating for remote communities with limited access to health care?
We know that our military, the men and women of our military, are always ready to serve, to help in a broad range of ways, Canadians who need that support. The field hospitals is certainly an expertise that the Canadian Armed Forces have, and they will make determinations, and we will all make determinations about how we can and where we can best help if it comes to that.
Hi, Prime Minister. Molly Thomas, CTV National News. Canadians, of course, are putting lots of money on their credit cards. They're raking up interest. Last week, you had mentioned that you had talked to banks about possibly deferring that interest. Any more movement on that?
Those conversations continue with the banks. We're also looking at ways of easing access to credit for individuals so that they can shift their bank balances and their credit card balances to a lower interest line of credit. These are things that we're continuing to work on because we recognize recognize that Canadians don't want to come through this with impossible levels of debt, and we're going to be there to help them out.
In French, please.
We recognize that it's important that people not come out of this crisis even in more debt than before, and that's why we provided the emergency benefit and the wage subsidy for businesses to keep people on the payroll. We also know that we can work with the banks, and that's what we're currently doing in order to try and get some changes with respect to credit cards. We're also looking at easier access to credit for individuals so that if they borrow money, it will cost less.
Reports that after more than a year, China is going to allow Canadian exports of canola. Can you confirm that? And is this a thaw in relations between the two countries?
I think we're recognizing that we're in a global situation where it is really important for countries to work together. We have seen promising signs of positive relations on specific issues, and we're going to continue working to try and ensure that our farmers, our manufacturers, our exporters continue to have access to the markets around the world, even in this difficult time.
Okay.
Nous allons continuer de travailler.
We will continue to work with our farmers and producers to ensure that they have markets for their goods. We also know that this is a time where people have to work together, and countries as well must work together. And I'm happy to see the positive signs that we can work together despite what is happening. Thank you.
And that is the Prime Minister of Canada giving his daily briefing to Canadians today.
We now join the following program in progress.